Almost 60,000 people have died from COVID-19 in China in the past 5 weeks. That's according to new data released on Saturday. It's a huge increase from previous figures, and health officials say the elderly have been hit the hardest.
Severely ill patients are mainly elderly people, with the oldest being 105, the average age 75 and a half, and those aged 60 and above, accounting for 89.6% of the cases. It's also common for them to have a variety of underlying diseases.
The World Health Organization and several countries have accused China of underrepresenting the scale of the outbreak. Early last month, Beijing abruptly lifted its zero-COVID policy after almost 3 years. Hospitals nationwide were overwhelmed and medical staff under enormous pressure, including American doctor Howard Bernstein.
Everything was just completely clogged up. The emergency room was full, every bed was full, the waiting room was full, waiting in to get to the emergency room, the fever clinic was full, and then all the ICU and hospital beds were taken.
Previously, only people who died from coronavirus-induced respiratory failure were included in the official death toll. Now, those who died of the virus, in combination with other illnesses, are being counted.
The government says the number of people being treated in fever clinics like these peaked in late December, but that number has now declined by about 80%.
Dr. Bernstein says his hospital is no longer crowded, but the outbreak is far from over.
There was a sort of shocking amount of illness and degree of illness, and now we're dealing with a different COVID phenomena, which I'm identifying as the people who are ill in December who have still do not feel like they've recovered.
Millions of Chinese are traveling from cities to remote regions in the lead-up to the Lunar New Year, movement that's expected to cause a surge in infections. Authorities are focusing on improving medical facilities and access to medicines in rural areas. International health experts have welcomed the new data, but as the figures only include those who died in hospital, they say the true death toll could be much higher. Katrina Yu, Al Jazeera, Beijing.